think a lot of patients find that the whole, I guess, breast cancer diagnosis is quite of a shock to the system already. Like often, especially, fortunately, we do see a younger, patient coming through these days, and also, with the more awareness of some of the cancer genes, like there's more patients undergoing through prophylactic surgery as well. So often that process of dealing with the cancer diagnosis is quite challenging, and then having to, I guess, think about that additional reconstructive process just added another level of psychological, stresses for the patient. But I think the main thing is once you come to the decisions of having the reconstructive surgery, then really it's just making sure that you are taking time off to recover from that process. A lot of the times I think patients hasn't necessarily been able to process the timing required for the recovery, and I think that's when there will be a little bit of a struggle, especially when we're undergoing some of the more complex surgeries, such as using your own tissue, because essentially that's like having two separate sort of surgical sites that have to recover. But I think once you sort of understand that, okay, look, this is going to be, if it is an implant, perhaps, the recovery will be a little bit quicker because everything is confined within that same surgical site. But if you are having your own tissue reconstruction, then there's that additional tissue site that you have to recover. But once you come to terms with the fact that there will be an additional surgical wound, there will be a longer recovery. And I think generally patients do pretty well from that perspective. And I think lots of patients are also quite fortunate that they can often rally some support from their family and friends who can help them with their household chores or other things. And I think once that is all in place, then most patients will find that the recovery is a bit smoother than what they expect.